I'm Dr. Freya Schnabel. I'm the Director of Breast Surgery at NYU Langone Medical Center. I think breast surgery is a really fascinating area of surgery, and I have always been attracted to the field because it involves knowing a lot of different things. The technical aspects are interesting, they're challenging, they're evolving rapidly. I think all that's great. But to be a very good breast surgeon, you also need to have understanding about a lot of other fields, including medical oncology, radiation oncology, breast imaging, genetics, the basic science of disease. And not only is this a very interesting and complex field, but it's also rapidly evolving. For the most part, we concentrate on treating breast cancer. But in addition, we also treat patients with benign diseases of the breast. And I have a particular interest in patients who are at high risk to develop breast cancer, either because of personal history or family history, including patients who have genetic predisposition to the disease. We have a very clear devotion and focus on women at high risk for breast cancer. Many times patients who are found to be at high risk for breast cancer feel a little bit at sea. They know that they're at increased risk, they don't have plans in place, they don't feel like they understand what they're supposed to do and how they can use the information to protect themselves. And we really have a very specific institutional focus on that group of patients, and we're here to coach them and guide them and help them along, focus on early detection and also focus on prevention of disease. My treatment philosophy is to know the patient and know the disease. One of the major advances in the contemporary approach to women with breast cancer and with all diseases of the breast is the concept of individualized or personalized medicine. The more we understand about a patient's disease, the more the treatment can be tailored appropriately. Amassing as much information as we can amass about a particular breast cancer, gathering all that information carefully and thoughtfully allows us to plan our treatments much better. I think on the other side of that coin is knowing the patient, understanding the patient, their personal history, their family history, their risk background. And if you put those two things together, for me, that's my philosophy. Treat the patient for their disease.